Hi, I am Dr. Boda from The Big Red Tooth. In this month's episode, we will be discussing dental emergencies and how to respond to them. What to do in a dental emergency before you reach the dentist. Dental emergencies can happen suddenly and often bring pain and stress and uncertainty. A severe toothache, a knocked out tooth, or sudden swelling can make it difficult to know what to do next. While professional dental care is essential, the steps that you take to reaching the dentist can play an important role in protecting your oral health. Quick and informed action can help manage discomfort, reduce the risk of complications, and improve the chances of saving a damaged tooth. Understanding how to respond to those first moments can make the situation easier to manage until you receive professional care. Managing severe tooth pain. Sudden or intense tooth pain is one of the most common dental emergencies. The pain may be caused by tooth decay, infection, inflammation, or a cracked tooth. While only a dentist can diagnose and treat the underlying problem, there are a few steps that can manage the discomfort in the meantime. Start by gently rinsing your mouth with warm salt water. This helps clean the affected area and may reduce irritation around the tooth and the gums. Avoid very hot or cold foods and drinks if sensitivity is present, and extreme temperatures can make the pain even worse. If food particles are trapped between your teeth, carefully floss and sometimes relieve the pressure and the pain goes away. Over-the-counter pain relief medication may also help reduce discomfort while waiting for your dental appointment, provided it is taken according to the instructions. Applying a cold compress to the outside of the cheek nearby the painful area may help reduce the swelling and provide temporary relief. It is important to avoid placing aspirin directly onto the gums or teeth, as this can irritate the surrounding tissue and cause chemical burns. Even if the pain becomes manageable, a dental evaluation is still necessary. Persistent tooth pain often signals an underlying tissue that requires professional care. Responding to a knocked out or broken tooth. Dental injuries can occur during sports, accidents, or falls. A knocked out tooth requires immediate attention, as quick action can significantly improve the chances of saving a tooth. If a permanent tooth has been knocked out, handle it carefully by the crown, which is the visible part of the tooth. Avoid touching the root, since it can damage delicate tissue that is important for reattachment. If the tooth is dirty, rinse it out gently with clean water. Do not scrub it or remove any attached tissue. Whenever possible, try placing the tooth back into the socket and hold it into position by gently biting on it on a clean gauze or cloth. If this is not possible, keep the tooth moist and by placing it in a container of milk or holding it on the inside of your mouth between the cheeks and gums. For a chipped tooth or broken teeth, rinse the mouth out with warm salt water and apply gentle pressure with a clean gauze if bleeding is present. Cold compress can also reduce the swelling. Collect any pieces of the broken tooth if they are available and bring them to the dental appointment. Seeking professional dental care as soon as possible is essential in these situations. Prompt treatment improves the likelihood of restoring the tooth and protecting long-term oral health. Managing swelling or signs of infection. Swelling in the gums, jaw, or face can indicate infection or inflammation within the tooth or surrounding tissue. Dental infections require prompt professional care, as they can spread if left untreated. If swelling occurs, rinsing the mouth with warm salt water may help keep the area clean and soothe irritated tissues. Drinking fluids and resting can also support the body while waiting for treatment. Applying a cold compress to the outside of the face can help reduce swelling and provide some comfort. It is best to avoid applying heat, since this may increase inflammation in certain cases. If swelling is accompanied by fever, difficulty in swallowing, or difficulty in opening the mouth, professional care should be sought out as soon as possible. These symptoms may indicate a more serious infection that requires urgent attention. Pain relief medication may provide temporary comfort while waiting for your dental appointment, but it should not replace professional treatment. Acting quickly protects your smile. Dental emergencies can feel overwhelming, particularly when it occurs without warning. Knowing how to respond during the first moments can help protect your teeth, manage discomfort, and reduce the risk of complications before you reach the dentist. Simple actions such as rinsing with salt water, protecting the injured tooth, and controlling swelling can support better outcomes until professional care is available. Seeking prompt advice from a dental professional remains the most important step in resolving the underlying problem. At the Big Red Tooth in Fourways, patients receive calm, professional care for urgent dental concerns. Quick action combined with expert treatment helps protect both oral health and long-term comfort, ensuring that dental emergencies are handled with confidence and care. At the Big Red Tooth Center for Advanced Oral Health, we are dedicated to creating confident smiles through expert, compassionate care.